Big question, a lot of pressure on the Prime Minister for that transparency. There has been enormous transparency from other countries. However, we have been watching projections coming out of the U.S., and this is the only measuring stick we have on how important the clampdown is. So what's the strategy in the PMO not to give that scientific modeling for Canadians?
Well, clearly, Lisa, it seems to me that they are not relying, or they find their data so far unreliable. Reasons. Perhaps the provinces and the federal government were stingy in testing Canadians. The tests came back very late, sometimes taking 10, 12 days. Second reason, perhaps, is the scattered information. You have one federal government and provinces and territories with different data accumulated in different ways. Third reason, well, the Prime Minister tells us it depends on our behavior and our attitudes. Shall we stay home longer? Well, then that curve may become a little bit, may go down a little bit. But my question is, if you do have various models, well, then give them to us. This is what could happen if we do stay home and social distance or physical distance. This is what may happen if we don't. They have that data. Why don't they want to produce it and tell Canadians, where are we going? How long will this last? They're being very vague also on personal protective equipment. How many do we have? The federal government telling us we have enough. Frontline workers telling us they don't have enough. And finally, yesterday, the health minister saying, well, actually, we don't have enough. So I guess this is a government struggling with its communication strategy.
Okay, Joyce, thanks for that. Let's find out what infectious disease specialists talk